Yes, calcified plaque is removed by a Nutritarian diet. Not as fast as the soft plaque. In other words, in your heart, you have different types of plaque. You have the plaque that's most dangerous is called vulnerable plaque or juvenile plaque. As the juvenile plaque is more dangerous because it has an area that is blocked between the soft cholesterol, mushy yellow stuff. The mushy movable is blocked from the vessel, center of the vessel, by a thin calcified cap. The lining of the blood vessel now has calcified cap on it, and as the blood vessel is moving, the calcified cap can move because the back of it is soft, and it could crack. And it could expose the innards to the vessel wall, causing a heart attack to occur. Over time, over the years, this becomes more calcified, and it gradually obstructs the lumen more and more. It encroaches on the center where the blood flows. And as that plaque gets older, and you start to feel pain in your chest because it's encroaching on the size of the lumen, it's not going to cause a heart attack. Because the calcified wall becomes thicker, and more smooth muscle infiltration evades the cholesterol plaque. So you have less soft cholesterol, more smooth muscle and more scar tissue, and more calcification. And what I'm saying right now is the plaques, the obstructive plaques that cause chest pains, are not the ones that cause heart attacks. It's the ones that are not obstructive, that don't cause chest pains, that cause heart attacks. That's when the doctor puts a balloon in there and stretches out your calcified plaque. He's not lowering the risk of heart attack, because that's not the plaque that was going to kill you anyway. It was the other plaque that isn't visual, that you can't see on a cardiac catheterization. Did you follow that? When your doctor does a stress test, which only sees a blockage that's 80%, and he tells you you're at high risk, you need to get an angioplasty or a catheterization to see if you should get an angioplasty. He's identifying those obstructive plaques that are not going to cause a heart attack. It's the ones he can't see that are dangerous. If you have a stress test and he tells you, look, fine, normal stress test, everything's good, everything is not good, you still can drop dead of a heart attack the next day because it doesn't visualize the most dangerous vulnerable plaques that are not obstructing. That's why doing angioplasties don't make you live longer, because it didn't address the plaques that are most dangerous, and it addressed the plaque that wasn't dangerous to begin with, but it made that plaque more dangerous by putting a wire and cage in there, which is now a foreign body, which is a nidus of inflammation that can cause a clot, and now you got to be on a clot-busting drug the rest of your life, which can cause a hemorrhagic stroke. So we took the person at risk, who could have had all the risk go away with a change in diet, and he put them now and made them into a person at higher risk, not at lower risk. But now doesn't have pain as much with exercise because he opened up the area which blood can flow. But right now, the American College of Cardiology and the American Heart Association do not recommend people put stents in for chest pain and for stable coronary artery disease, only for emergencies which are undergoing a heart attack or acute coronary syndrome. But still, thousands of them, tens of thousands are done every day all across the country. It's really malpractice. But the calcified plaques can slowly go away. What I'm saying to answer that question is, the most dangerous plaques rapidly go away. The person becomes to a safer point within days, and within weeks they're really at 100 times safer with the change of this diet. And the calcified obstructive plaques you saw with John Pelikowski, you couldn't on the stress test, the calcified plaques melt away, but at a slower rate. Those take years to go away. Right? The dangerous plaques go away relatively quickly. The calcified plaques go away slowly over many years, and any residual obstruction or residual calcifications in the scar tissue is not dangerous and not going to cause a heart attack.